Now we're going to demonstrate the traditional stemmed implant. So what happens if the bone quality in a patient isn't good enough to provide stability to the stemless implant? That is an important factor. You do have to have good bone to have this type of implant placed. So intraoperatively, if we had planned for this and the bone wasn't great, we can easily convert to the stemmed implant. Or in the cases of a reverse shoulder replacement, where we have to use currently a stemmed implant, this is how we'd proceed with that opportunity. So in this situation, we're actually going to remove the stemless implant that we have placed. So we'll tap this back out. Now what we can do in this situation is we would create a canal in the humerus, matching the canal of the humerus itself. So this is a little starter awl that allows us to create that pathway. And we find the canal, and we carefully ream that area out. And then we'll have an actual reamer. So these are different sizes. And this helps us to open up the canal where the implant will be passing through. We want to be careful with this because we don't want to create a fracture of the bone. And so we'll be going carefully down the canal. It's a pretty tight canal here. Now, we also have what we call version. So version is the direction in which we make the cut. And normally we set that to be about 20 degrees. And that's the angle that we'd make the actual cut on the humerus relationship to the rotation of the arm. So once we have determined that to be appropriate, we then create a little pocket for the implant. So we'll tap a little path into the bone. And then we'll actually impact the stem. Now this stem can also be adjusted at different angles depending on the level of the bone cut. So this will be carefully impacted. So as we said, we can adjust the angle of the implant to match more of the cut. And then we will take the humeral head. So again, this is cobalt chrome. This goes into the center. And so this is an anatomic humeral component. So now that we've covered the humeral side, we're going to move on to the socket side. And we're going to start with our standard anatomic shoulder replacement and show you the technical aspect of replacing the socket here with the piece of plastic or polyethylene that we've shown you before. So in the operating room, the way this works, we have multiple sizes and shapes to work with. And so the first thing we do is find a template that basically says this is the size and the orientation that we're going to put in the plastic implant. So we have these little guides that we use during surgery that give us the size and the radius of curvature. So how curved is the actual socket? And so by using this, we can indicate that looks pretty good in that direction, and it looks fairly good in that direction. So we try to get as close as we can to the shape of your own socket in terms of putting on the piece of plastic. The reason we do that, we want to preserve as much of your bone as possible. So now that we've determined the appropriate size, we have a guide that will allow us to put a pin into the actual socket. That pin will allow us to create and shape the socket that the plastic portion will fit to properly. So we have a drill with a pin. We're going to place this in the center of the actual socket just like we would in the operating room. And once we've determined the appropriate position, we will drill in the pin. That now gives us a guide in which to start shaping the socket. So our next step is called reaming. This is where we remove any bone spurs or any extra bone that might be around that could impact our ability to place the implant properly. So this is a reamer, circular in fashion. These blades are very sharp, and what it's going to allow us to do is shape the bone again. Once we start the ream, we check it periodically to make sure we're not taking away too much bone. We want to smooth it out just enough for the implant to fit properly. So we usually take the little checker back. So this is the thing that started. And this allows us to make sure that we've properly oriented the implant. Now by looking at this, I'd say, well, we're pretty close, but still need a little work. So we're going to take the reamer back because we don't want to have any gaps between the bone and the actual plastic implant. That can reduce the longevity of the implant over time. So we want to make sure we have perfect flat surface, or actually rounded surface, that matches the plastic implant. And once we think we've had enough bone removal, we will check it once again, and that actually sits quite well overall. So this should provide a nice stable implant long term. Now we prepare the center of where the implant will go. So this drill bit's going to create a somewhat larger hole than the rest. We'll then remove this pin. Now that will be the center of the actual implant that we're going to place in the shoulder. So we remove this. Now this guide here has 3 little holes in it. This allows us to center it in the socket. And now we're going to drill what's called the peripheral holes for the pegs. If you remember the shape of the implant, and we'll review that with you in a moment. So we'll start, you can start at either 3 of these. We'll start at the top. And we put a pin in there to keep it from rotating on us. Once we've had the appropriate orientation, we want to make sure it stays in that orientation. And just as a reference, on this anatomical model, this is the front of the shoulder, it's called the coracoid, and this is the back of the shoulder. This is the spine of the scapula or shoulder blade, just to give you an orientation. So now, these are the trial implants, and they come in multiple sizes and shapes. This is fairly flat in origin, and we're going to basically implant that into the body. And we have an impactor here. It allows us to make sure that that implant is well seated. It's nice and solid and stable. And so the actual implant itself will be similar in shape and size. Clean that off. So here's the actual implant that will be placed inside that area. And by impacting that, you can see there's some fins on this implant. Those fins will actually allow bone to hopefully grow in between there to help stabilize the implant long term. This will allow the implant to hopefully last longer and remain stable inside the body. So this would be impacted into the socket in the same orientation that we drilled. And there you have the seated implant. Again, this is a little larger than the model, but that's essentially what the implant would look like inside the actual socket itself. And that is the original standard anatomic total shoulder socket.